medicine physician at Brooklyn Center. My team in front of me, want to stand up real quickly. I thank them, especially Nazir Ahmed, she's sort of the engine behind us who kept this rolling. Thank you. So, the arrow, is that how you do this?
Yep. Or you can just click it on the mouse too.
Oh, okay. Okay, the aim to increase by at least 10% of our patients of color who complete colorectal cancer screening by 2011. Number two, to improve our percentages of screening in patients of color from 45 to 55%. Evaluation. We successfully met our goals. We built good relationships within our clinic and within our patients and our community advisors. Disparities advanced in the clinical setting by well above our goal, and our measures improved significantly. Is there no graph? I guess there's no graph. Sustainability. We will sustain our practice of encouraging patients through the counseling on both benefits and ease of fit testing. We will continue working on the challenge of the colonoscopy testing. We have successfully ingrained this work into your patient care process and work with EPIC specialists to populate into the after-visit summary for those patients needing colorectal cancer screening information about the procedures and importance of completing the tests. Our spread. Care team education of fit testing as an easy spread. Cultural awareness and background of taboo and beliefs should be spread to aid in talking points with patients. Challenges are overcoming whatever prevents staff from having uncomfortable conversations. So this is starting off in July of 2010. I don't know if you can see this, but okay. Is that better? Okay, so here's Brooklyn Center patients of color. We started down here, and we're the blue line. You can see that or not. So by December of, so this is what our clinic did starting July of 2010, and here it is December 2011. So we went like this.
What is that? Is that what's on the vertical axis?
Okay, this is the horizontal is the date, and these are percent of patients who have met colorectal cancer screening. Okay, so starting July, our patients of color were about 43%, and by the time we finished December 2011, it was 67%.
Wow.
Now, you know, it'd be nice if we could take all the credit here, but frankly, we can't do that. The fit test. Now, the fit tests are stool cards. Sort of like the old stool hemocoat cards that you hand the patient, and they and it's just a matter of 2 stool samples, and they mail them in. As it's been mentioned, patients, the colored patients from East and West Africa and Southeast Asia, they have a hard time doing invasive procedures for preventative services. So the fit test was a much easier sell. So that came out right about in July. So you can see this number's improved quite a bit just from the fit test. Our EBAN project started about December of 2010. So, but our first PDSA cycle didn't start until about March. So we were already up to here when our first PDSA cycle started. And our first cycle was just myself and Dr. Ahmed educating our patients, and also our rooming nurses educating our patients about the fit test. So as you can see here, we started, we were going up and down here for just when 2 providers in the clinic were doing it. So our second PDSA cycle, we expanded it to a 3rd provider. Didn't really do too well. And then finally, we expanded it on our 3rd PDSA cycle to the entire group. We have nine providers in our group. And that's when we really took off. And stunningly well. We're very happy.
Yeah, that is.
The challenge is going now. I should just explain. This is the health partners system-wide patients of color. So they started off much higher. So a lot of this is because we sort of sucked when we started off. white patients are up here. So as you can see, as we went along, as the tide rises, all the boats rise too. So our rates of white patients also went up, and this is Health Partners system-wide. So our disparity was about 23% when we started off, and then we raised it to about 10%. So we succeeded what we wanted to.